Hi, everybody. I'm Benita Perkins with Durham County Public Health, and I work with employee wellness. I'm also president of Benny Girl Healthy Lifestyle Branding and Communication, and my company works with other companies, organizations, and nonprofits to focus on a healthy lifestyle messaging. This webinar today, Alternative Therapies for the Pain, is about quality of life, which involves healthy lifestyle. So let's get started. Okay, and I lost it. Hold on. There we go. Let me get back to the right slide. Okay. And so again, I'm Benita Perkins with Durham County Public Health. And this webinar is Alternative Therapies for Healing the Pain. Pain occurs when something hurts, causing an uncomfortable or unpleasant feeling. The presence of pain often means that something is wrong. Each individual is the best judge of his or her own pain. Sometimes pain has a purpose. It can alert us that we've sprained an ankle, for example, and this pain keeps us from doing further damage. It helps alert people to the fact that something is wrong with their body and needs attention, spurring action to minimize injury. For example, pain makes you recoil when you touch a burning hot stove or lets you know you've cut your finger while slicing tomatoes, so you'll tend to the wound. In severe cases, extreme pain warns you of life-threatening danger, so you'll seek emergency medical help, as in the case of the squeezing pain of a heart attack. For many people, pain can linger for weeks or even months, causing needless suffering and interfering with quality of life. Acute pain. What is the difference between acute and chronic pain? Let's go over that. Acute pain usually comes on suddenly and is caused by something specific. It is sharp in quality, and acute pain usually doesn't last longer than a few months, maybe more like a few weeks. It goes away when there is no longer an underlying cause for the pain. Some causes of acute pain include surgery, broken bones, dental work, burns or cuts, labor and childbirth. And after acute pain goes away, a person can go on with life as usual. Chronic pain is ongoing and usually lasts longer than 12 weeks. This type of pain can continue even after the injury or illness that caused it has healed or gone away. Pain signals remain active in the nervous system for weeks, months, or years. Some people suffer chronic pain even when there is no past injury or apparent body damage. Chronic pain is linked to conditions including arthritis, cancer, nerve pain, back pain, fibromyalgia, carpal tunnel syndrome, musculoskeletal injuries like neck, shoulder, knee, or back, irritable bowel syndrome, migraine headaches, and tension headaches. People who have chronic pain can have physical effects that are stressful on the body. These include tense muscles, limited ability to move around, a lack of energy, and appetite changes. Emotional effects of chronic pain include depression, anger, anxiety, and fear of re-injury. Such a fear might limit a person's ability to return to their regular work or leisure activities. An overwhelming number of people use medication to ease chronic pain. In a study of multiple sclerosis patients who experience chronic pain as a side effect of the disease, 45% used medication to ease pain. However, in the same study, many of the participants were also engaged in non-medication techniques to ease pain. There are issues with medication to ease pain. Today's focus is on techniques to relieve chronic long-term pain. And while medication is very helpful, there can be negative side effects. Opioids are heavily prescribed for pain management. Unfortunately, they are also associated with elevated risk of overdose, misuse, dependence, or addiction, which can lead to death. Over time, opioids tend to be less effective or require higher doses, especially for dealing with nerve type pain. Acetaminophen have the least amount of extended use issues, but may not be as productive in managing pain as other options. In addition, drinking alcohol while taking acetaminophen can cause liver damage. NSAIDs, like Aleve or Advil, regular long-term use of these have been linked to ulcers, stomach bleeding, kidney problems, high blood pressure, and increased risk of heart attack or stroke. NSAIDs should be avoided if you have high blood pressure, heart disease, or kidney problems, or if you're taking blood thinners. Skeletal muscle relaxants are drugs that were approved years ago for short-term treatment of muscle spasms and skeletal pain, and are used today without good evidence to treat chronic pain and other conditions. Recommendations generally limit the use of these drugs to a maximum of 3 weeks, since they have not been shown to work for muscle spasms beyond that duration, and they can cause serious side effects, including falls, fractures, vehicle crashes, abuse, dependence, and overdose. Due to these risks, muscle relaxants should be avoided altogether in elderly patients. If your pain has overstayed its welcome, you should know that you have more treatment options today than ever before. Here we've listed a few techniques to control and reduce your pain, and they don't require taking a pill. Some of these treatments will be familiar and straightforward, and some may be new or eye-opening. The first one we're going to look at is cold and heat. These two tried and true methods are still the cornerstone of relieving pain for certain kinds of injuries. If a homemade hot or cold pack doesn't do the trick, try asking a physical therapist or chiropractor for their versions of these treatments, which can penetrate deeper into muscles and tissues. Exercise. Physical exercise activity plays a crucial role in interrupting the vicious cycle of pain and reduced mobility found in some chronic conditions like arthritis and fibromyalgia. Try gentle aerobic activities like walking, swimming, or cycling. Physical and occupational therapy. These two separate specialties can be among your staunchest allies in the fight against pain. Physical therapists guide you through a series of exercises designed to preserve or improve your strength and mobility. Occupational therapists help you learn to perform a range of daily activities in a way that doesn't aggravate your pain. These therapies overlap. A therapist might review your overall medical history and perform various tests and measures to get a sense of any impairments that may be contributing to your pain, including range of motion, posture, strength, balance, and endurance. Chiropractic treatment. Chiropractic treatment is the most common non-surgical treatment for back pain. But how does it work? Chiropractors perform spinal manipulations or adjustments to manually restore joint mobility and heal injured tissues through controlled force. A chiropractor may also be helpful to treat musculoskeletal complaints like migraine headaches, fibromyalgia, joint pain, neck pain, and certain arm and leg conditions. Serious complications like stroke, pinched nerves, and worsening of herniated disc have rarely been reported. How effective is chiropractic treatment? The American Chiropractic Association provides excerpts and summaries from recent studies that support care as an effective treatment for chronic and acute pain, headaches, and neck pain. Approximately 30 million people receive chiropractic treatment each year, so it appears to help many. Mind-body treatments. There are several body treatments to consider. We will discuss each briefly, including cognitive behavior therapy, mind-body techniques, guided imagery, biofeedback, and hypnotherapy. First, let's look at cognitive behavioral therapy. This is a form of talk therapy that helps people identify skills to manage negative thoughts and behaviors. For pain management, cognitive behavioral therapy, or CBT, helps patients change their awareness of pain and develop better coping skills, even if their pain doesn't change. Currently, CBT is the prevailing psychological treatment for individuals with chronic pain conditions. CBT has also been applied to pain associated with cancers and its treatment, as well as anxiety and insomnia. But how does cognitive therapy work? CBT focuses on the relationships between thoughts, behaviors, and emotions. Negative beliefs about pain can lead to bad coping, exacerbation of pain, increased suffering, and greater disability. CBT teaches patients effective coping strategies and helps replace negative thought patterns with less harmful thoughts, helping patients increase adaptive behaviors and identify and correct bad thoughts and beliefs to increase their ability to manage their pain. How effective is CBT? Numerous analysis and large randomized controlled studies support CBT for chronic pain. A review of 22 studies found that CBT has positive effects on pain intensity, pain-related interference, and health-related quality of life and depression. One large study looked at short and long-term effects of CBT for chronic temporomandibular disorder, a condition that causes severe pain and discomfort to the face, jaw, neck, and shoulders. A 12-month follow-up of these patients found that they were three times more likely to report no pain interference and twice as likely to report clinically meaningful improvement compared to the control group who did not receive this treatment. Mind-body techniques. These techniques include meditation, mindfulness, and breathing exercises, which can help you restore a sense of control over your body and turn down the fight or flight response, which can worsen chronic muscle tension and pain. There are many mindfulness apps that can get one started on that road, or look for professionals who can provide guidance for using this tool. Again, there's a lot of apps on your phone and on your computer that provide a lot of meditation and mindfulness exercises and techniques. Guided imagery. Guided imagery goes one step further with mindfulness to manage pain using relaxation techniques and visualization of calming mental images to manage acute and chronic pain. But how does it work? When you're under stress, your body's fight or flight mechanism kicks in, as we mentioned. Cortisol and other stress hormones can ratchet up inflammation levels in your body. Mind-body practices like guided imagery calm the nervous sympathetic system. While in a deep state of relaxation, you visualize your body as you wish it would be. The process eases stress and lowers cortisol levels, bringing a decrease in pain perception and anxiety with it. But how effective is it? Closing your eyes and imagining your pain away? It may sound like an ineffective method of pain management, but a comprehensive study found evidence that this relaxation and visualization technique can be effective for the management of cancer-related pain, anxiety, nausea, and depression. In a review of 7 randomized controlled studies, guided imagery brought statistically significant improvements for all 287 individuals suffering from arthritis and other rheumatic diseases who were in that study. Biofeedback. This therapy can help you gain more control over normally involuntary nerve pain signals. It's used to help prevent or treat conditions like migraine headaches, chronic pain, incontinence, and high blood pressure. This technique involves learning relaxation and breathing exercises with the help of a biofeedback machine, which turns data on physiological functions like your heart rate and your blood pressure into visual cues like a graph or a blinking light or even an animation. Watching and modifying the visualizations gives you a degree of control over your body's response to pain. During a biofeedback session, electrodes are attached to your skin, and finger sensors can also be used. These sensors send signals to a monitor which displays a sound, flash of light, or image that represents your heart, breathing rate, blood pressure, skin temperature, sweating, and/or muscle activity. The idea behind biofeedback is that by harnessing the power of your mind and becoming aware of what's going on inside your body, you can gain more control over your health. When you're under stress, your heart rate speeds up, your muscles tighten, your blood pressure rises, you start to sweat, and your breathing quickens. You can see these stress responses as they happen on a monitor and then get immediate feedback as you try to stop them. Biofeedback sessions are typically done in a therapist's office, but there are computer programs that connect the biofeedback sensor to your own computer. A biofeedback therapist helps you practice relaxation exercises, which you can fine-tune to control different body functions. For example, you might use a relaxation technique to turn down the brain waves that activate when you have a headache. And last of the mind-body therapies, hypnotherapy. Hypnotherapy is an alternative practice where a licensed hypnotherapist guides your mind to a highly focused mental state. Hypnosis used for, but how does this work? Hypnosis used for treatment of chronic pain typically involves a hypnotic induction followed by suggestions for comfort and relaxation. Patients are often taught a cue that they can use on their own to quickly enter a state of comfort. But how effective is it? A review of 13 controlled studies revealed that hypnosis is significantly effective for chronic pain conditions, including low back pain, arthritis, cancer, and disability-related pain. In some cases, hypnotherapy reduced chronic pain for up to 3 months. In one controlled study, fibromyalgia patients who received hypnotherapy showed significant improvements in pain reduction as well as fatigue and sleep patterns. Yoga, Tai Chi, and Pilates. These exercise practices incorporate breath control, meditation, and gentle movements to stretch and strengthen muscles. Many studies have shown that they can help people manage pain caused by a host of conditions, again, headaches, arthritis, to lingering injuries. In my Pilates classes, I've had many students extol the benefits of Pilates for their lower back pain. Therapeutic massages. Not just an indulgence, a massage can ease pain by working tension out of muscles and joints, relieving stress and anxiety, and possibly helping to distract you from pain by introducing a competing sensation that overrides pain signals. A massage aims to reduce pain by increasing healing and disturbing the pain signals sent to the brain. During the massage, the skin and fingers create friction. Friction encourages blood flow to increase. Oxygen and nutrients are carried within the blood flow, and these nutrients are essential for the repair of damaged muscle fibers. Increasing blood flow, therefore, increases the rate of healing, helping to reduce pain. The friction created between the skin and fingers also creates a new sensation. The new sensation is picked up by the receptors within the skin, disturbing pain signals, and the signal is sent to the brain, which means fewer messages are sent to nerves to create a feeling of pain. Disturbing the signal sent to the brain, therefore, reduces the pain. Therapeutic touch and Reiki healing. Reiki is a Japanese technique for stress reduction. that also promotes healing. It is administered by laying on hands and is based on the idea that unseen life force energy flows through us and is what causes us to be alive. If one's life force energy is low, then we are more likely to get sick or feel stressed. And if it is high, we are more capable of being happy and healthy. Therapeutic touch and Reiki healing are thought to help activate the self-healing processes of an individual and reduce pain. These energy-based techniques do not require actual physical contact. They do involve close physical proximity between practitioner and patient. In the past few years, several reviews have evaluated published studies on the efficacy of these healing approaches to ease pain and anxiety and improve health. Although some studies show these techniques are beneficial and have no significant adverse side effects, the limitations of these studies make it difficult to draw definitive conclusions. Further studies are needed before evidence-based recommendations for using these approaches for pain can be made. But hey, if it works for you, it's good. Acupuncture. Although the World Health Organization currently recognizes more than 30 diseases or conditions that can be helped by acupuncture treatment, one of the main uses of acupuncture is for pain relief. 16th century Chinese doctors believed that illness was due to an imbalance of energy in the body. In acupuncture, disposable stainless steel needles are used to stimulate the body's 14 major meridians or energy carrying channels to resist or overcome illness and conditions by correcting these imbalances. Acupuncture is also thought to decrease pain by increasing the release of chemicals that block pain, endorphins. Many acupoints are near nerves. When stimulated, these nerves cause a dull ache or feeling of fullness in the muscle. The stimulated muscle sends a message to the central nervous system, the brain and spinal cord, causing the release of endorphins, which can help reduce pain. Endorphins, along with other neurotransmitters, block the message of pain from being delivered to the brain. Acupuncture may also be useful as an accompanying treatment for pain-related conditions like headache, low back pain, menstrual cramps, carpal tunnel syndrome, tennis elbow, fibromyalgia, arthritis, and other pains. Plant-based herbs and spices. Many herbs and spices can treat inflammation and other related conditions. Willow bark, people have been using willow bark to ease inflammation, the cause of most aches and pains, for centuries. The bark of the white willow contains the chemical salicin, which is similar to the main ingredient in aspirin. Originally, people chewed the bark to relieve pain and fevers. Now, willow bark is sold as a dried herb that you can brew like tea. It also comes as a liquid supplement or in a capsule form. You can use willow bark to help relieve discomfort from headaches, low back pain, arthritis, and many other conditions. However, willow bark comes with its own risk of side effects. It can cause stomach upsets, it may slow down your kidneys, and can prolong bleeding time, just like aspirin. It should only be used by adults. Similar to how aspirin is taken in large quantities, it can be harmful for children. If you're sensitive to aspirin, or if you're taking any over-the-counter anti-inflammatory drugs like ibuprofen or naxaprin, you should avoid willow bark. Talk to your doctor before taking it if you're taking other anti-inflammatory or pain medications. Turmeric is the spice that gives curry its yellow color and unique flavor. It contains the compound curcumin, an antioxidant that helps protect the body from free radical molecules that can damage cells and tissues. Some people with arthritis turn to turmeric as a natural pain reliever because it helps relieve inflammation. Cloves, which are most often used for cooking. As a medicine, cloves can be found in capsule or powder form or oil form. Like other herbal supplements, you can use cloves to treat a wide range of conditions, and it may help ease nausea and treat colds. Cloves have been associated with pain relief for headaches, arthritis, toothaches, and as a topical pain reliever. The active ingredient in cloves is eugenol, a natural pain reliever that is also used in some OTC over-the-counter pain rubs. Rubbing a tiny amount of clove oil on your gums may temporarily release toothache pain until you can get to a dentist. But don't use too much because it can have side effects. As with willow bark, folks who are using blood thinners or have bleeding disorders should be careful when consuming clove products. Essential oils and aromatherapy. The U.S. Food and Drug Administration doesn't regulate essential oils. This means that essential oils products can vary in purity, strength, and quality across manufacturers. Be sure to only purchase essential oils from reputable brands. Essential oils can be inhaled or topically applied when mixed with a carrier oil. Never apply undiluted essential oils directly to the skin. Do not swallow essential oils. Do a skin touch before applying diluted oils to your skin. Let's look at aromatherapy. For most people, the idea of smelling something to make you feel better sounds silly at best. But aromatherapy has been used for pain management since the time of the ancient Egyptians. Peppermint oil, lavender oil, chamomile oil, and other oils have been used. How does aromatherapy work? According to Psychology Today, aromatherapy positively stimulates the limbic system of the brain to ease chronic pain and anxiety. How effective is it? Dr. Oz studied aromatherapy to expedite recovery time and reduce anxiety for his heart patients. He says that aromatherapy is effective because it works directly on the amygdala, the brain's emotional center. He recommends lavender, chamomile, or eucalyptus oil, or even the scent of green apples to reduce migraines and joint pain. According to the University of Maryland Medical Center, aromatherapy has been shown to be effective to relieve anxiety, stress, depression, and in several clinical trials has been used in laboring women to reduce the need for pain medications during labor. Other essential oils. Lavender. According to a 2013 study, lavender oil may help treat pain in children after tonsillectomy. Children who inhaled the scent of lavender were able to reduce their daily dose of painkillers post-surgery. So it would be aromatherapy option as well, right? Researchers in a 2015 study found that lavender essential oil can be an effective analgesic and anti-inflammatory aid. When diluted lavender oil was applied topically in one test, it provided pain relief comparable to the prescription medication tramadol. This suggests that lavender could be used to help treat pain and other associated inflammation. Another study tested lavender oil's ability to reduce pain in people who experience migraines. Results showed that inhaling the scent was effective in lessening the severity of migraine headache symptoms. Rose oil is another oil which many women who experience abdominal cramping during menstruation tried. It was shown to relieve pain associated with periods when paired with conventional treatment. Research from a 2013 study suggests that rose oil aromatherapy may also be effective in alleviating pain caused by kidney stones. Another essential oil is bergamot for helping pain. Bergamot essential oil therapy is being used to treat neuropathic pain, which is often resistant to opioid pain medications. A 2015 study found this therapy to be successful in reducing neuropathic pain. Dietary approaches. Some people believe that changing dietary fat intake and or consuming plant foods that contain anti-inflammatory agents can help ease pain by limiting inflammation. While medication and other treatments are important, many experts say an anti-inflammatory diet may help with conditions like arthritis. Changing what's on your plate won't be a magic cure, but an anti-inflammatory diet might lessen the number of flare-ups you have, or it might help take your pain down a few notches. An anti-inflammatory diet is widely regarded as a healthy diet. Even if it doesn't help with your condition, it can help you lower your chances of having other problems. Anti-inflammatory diets consist of fruits and vegetables, whole grains, beans, nuts, and fish. Your typical healthy diet, right? Nutritional supplements. There is some evidence indicating that glucosamine sulfate and chondroitin sulfate may be marginally effective for knee arthritis, but other studies have found no benefit at all. These natural components are found to be well tolerated and safe. If you use these and they work for you, then it's a good pain management option. And lastly, medical marijuana. Medical marijuana is a controversial non-opioid alternative for pain. Spurred on by recommendations from the World Health Organization, the United Nations voted to recognize the medicinal value of cannabis. More and more states are passing laws allowing medical marijuana use for conditions like pain, headaches, nausea, seizures, and Crohn's disease. But how does it work? Marijuana contains many chemical compounds, but THC is the cannabinoid in marijuana that has been most widely researched. THC binds to receptors in the brain to produce effects such as reducing pain or anxiety. THC also provides the sensation of being high, which makes this a controversial treatment option. Is medical marijuana effective? 6 of 7 double-blind studies associated cannabis use with lowered chronic pain and neuropathic pain. According to a report by U.S. Health and News, medical marijuana appears to be a mostly safe treatment for chronic pain without an increased risk of side effects. A study found that medical marijuana had a better safety profile when compared to opioids for long-term chronic pain. So in conclusion, alternative pain treatments can be used with traditional medicine or as an alternative to it. However, as with other types of treatments, complementary and alternative medicine doesn't work for everyone the same way. If you're considering complementary and alternative medicine, have a conversation with your doctor first. Remember, you may have to try several alternative methods or perhaps a blend of treatments to figure out which ones will work best to alleviate your pain and other symptoms. So everyone, thank you so much for joining. Actually, I should, let me see if I can find it, post my contact information, right? Let me go to the next slide. If you have questions or just want to reach out and find out what some of my sources were, you can reach me at bperkins@dconc.gov, or I don't have it here, but benita@bennygirl.com. And yeah, have a gander, do your own research, but hopefully this has been helpful in getting to think about, for those of you who are having chronic pain issues or know someone who is, looking at some alternatives to that are more holistic and natural and might be just as helpful. Thank you so much for joining me, and see you next time. Bye.